Why you worry? Hey everyone, this is Faheem and today I'm going to show you how a day goes in the life of a med student and show you people around. So my day begins like this walking. I have to go to the college and I'm already running a bit late and reach the bus stop till my college bus comes. Here I have reached the stop. After waiting for 5 minutes, the bus came. After boarding the bus, I decided to take a random video of myself and mostly I slept the whole journey. It usually takes 45 minutes to reach my college from where I live. So after reaching the campus, I met my friends and headed towards my lecture hall because there was a class on PSM scheduled that day. Now let me just tell you people some stuff in the schedule. The college timings are from 9 to 4 and from 9 to 11 there are two lectures of 1 hour each, and from 11 to 1 there are clinical postings where we go to the hospital and see some patients and discuss what is wrong with them. What I like to do is going to the casualty department of my hospitals and practice giving injections, measuring patients' vitals, taking ECG and take a brief history and figure out what's wrong with them. We have very awesome teachers over here who are open to discussing any case, and I have a habit of asking a question right away if I don't get anything. So these guys help a lot. Now coming back to the lecture hall, there were two classes on PSM and the other was general surgery. And after that, I went to the hospital for my clinical postings. I was posted in the surgery department that day, and the examination of a swelling was taught. After the discussion, we gave our attendance and went back to the college. So 1 to 2 is a lunch hour. After having my meal, I went to the library and spent my rest of the time there. So 2 to 4 is again theory class of different subjects, but it was Friday that day, and 2 to 4 is sports. And you can see people playing volleyball over there. And here I am in the library. So let me just tell you that our college held a conference on World AIDS Day on 1st December, and there was a brief discussion about AIDS, which is short for acquired immunodeficiency syndrome, which we have to know as a medical professional and handle AIDS patients in the best manner possible. The best thing I learned from the conference was one of my professors from Ophthalmology department. She gave us a clinical scenario and asked us what would you do. She said if a pregnant lady came to you with HIV positive report and in her first trimester, what will the manner in which you behave in front of her and how you conduct yourself. The foremost thing she said is don't play God and don't judge the patient. As it is stigma attached in relation to this disease, but a doctor's duty is to treat everyone equally and not stigmatize the patient. Make the patient comfortable and don't say things like you are suffering from this, so this is going to happen to you. No, I mean that sounds pretty wrong, right? That sounds pretty wrong. Give scientific backing to what you think and frame what you think and frame sentences like mostly people who suffer from what you are suffering progress like this, and there is a chance that this might be the outcome. And most importantly, ask the patient to be ready as to what's gonna happen. And so dealing in these kind of sensitive situations mindfully is what it takes. Also, there was a skit on post exposure prophylaxis, which means what you should do if you are exposed to the HIV virus, and it was a good skit which was performed by my seniors. One of my seniors played the intern who gets stuck with a needle which was infected with the blood of the HIV positive patient, and she gets panicked and goes to her senior, and her senior mindfully explains her what are the risk what risk case she lands into and what she should do after pricking a needle with a HIV positive blood. So it was a pretty good skit, and also my college people, they presented very beautiful posters, and I think at this point of time I have only 72 subscribers, which are a bit less. So I would ask all of you to please subscribe to this channel, and I would very much appreciate it, and also it's free. So I think that's very much it. Comment down below, like this video, and what do you think, what is in your schedule. Be curious and keep learning.